You're looking at an image from just last month, body parts on Copacabana Beach. It was a scene that couldn't have been predicted 7 years ago, when Copacabana Beach erupted. The Games were to be a legacy for Rio. In its bid, Brazil promised to clean up at least 80% of the sewage that was flowing into the city's notoriously dirty water.
This is a challenge for us, and you can be sure that we will not waste this chance at history.
In fact, some of the city's most dilapidated quarters have been turned into green spaces. Here, public art is being spray painted on walls. But the rest of the world is more concerned about this spraying. We know that Brazil is the epicenter of the Zika epidemic, and as the numbers continue to increase in Florida, experts are continuously looking here to try and find some answers. For example, we know that more than 1,700 children have been born with Zika-associated microcephaly, a birth defect. We also know that 150 public health experts called for the Olympics to either be delayed or moved because of concerns about Zika. But I want to be clear about something. The weather is starting to cool here, even as it warms up in the United States. And as a result, the threat of infection is pretty low. According to the University of Cambridge study, out of the hundreds of thousands of tourists who are likely to visit the Olympics, there will probably be only 1 or 2 infections. But that still hasn't kept some of the athletes from dropping out of the games.
Honestly, if my wife wasn't pregnant right now, I would be going to Rio. I mean, my biggest concern is for the baby on the way.
Now remember, even if he went and then didn't show any symptoms, Van Garderen could still be infected and potentially pass the virus on to his wife. After all, only 20% of those infected have any signs of the disease. But when it comes to athlete health, the concerns here are not just about Zika. Those promises of clean water, not in Guanabara Bay, where sailors will be competing for gold and where trash and sewage continues to litter the surface.
Every time you got some water in your face, it feels like there's some alien enemy entering your face, so I keep my nose and my lips closed.
His teammate, Eric Heil, believed the waters are the source of the multiple infections he contracted last year after racing in an Olympic qualifying event. Just last month, Brazilian scientists detected the superbug CRE in these waters.
Very little has been done, and the measures that were taken were not done the way we would have liked them.
Brazilian officials say the waters have met international standards. But then just 1 month ago, the WHO said that athletes may become ill from this water. And U.S. Olympic doctors are prepping their teams for such a situation.
We have a number of medications that they can take prophylactically to avoid those illnesses, and then also to treat the illnesses as well.
And doctors on the ground have another concern.
If there were a big catastrophe, an attack, or a brawl, we don't have the infrastructure to deal with it.
Political and economic crises have burdened local hospitals. Even under normal circumstances, waits for emergency surgery can be as long as 6 days. But Rio's mayor says the game's legacy will not be a shadow on Rio.
Don't come here expecting that everything will be, perfect. We live in a country that has economic crisis, a country with lots of inequality, with all the problems that we've seen. But the city will be much better than it was when we got the games.
Dr. Sanjay Gupta, CNN, Rio de Janeiro.